The biography of Madeleine Leininger. She was born on July 13, 1925 and died on August 10, 2012. She was pioneering nursing theorist and anthropologist, known for her work in transcultural nursing. She was born in Sutton, Nebraska and earned her nursing diploma from the Lincoln School of Nursing. Leininger later obtained a master's degree in nursing from the Catholic University of America and a doctoral degree in cultural and social anthropology. Madeleine's most significant contribution to nursing was her development of the transcultural nursing theory, which emphasized the importance of understanding a patient's cultural background. And to promote effective care, she founded the journal Transcultural Nursing and established the first graduate program in transcultural nursing at the University of Hawaii. So, throughout her career, she authored numerous books and articles promoting the integration of cultural competence in nursing education and practice. Madeleine's work had lasting impact of nursing, encouraging the healthcare professionals to respect and incorporate cultural diversity into patient care. So now we're going to move in Madeleine's major concept, which is the transcultural nursing. It's about the importance and understanding cultural differences which can provide effective patient care. Here's the summary of her key concept and definition.
Care and caring. Care is an abstract phenomenon involving actions, attitudes, and practices to assist others in healing and well-being. It includes generic or folk care and professional care which influence and explain the health and well-being of diverse culture. While generic care is the use of learned, indigenous, traditional, or local folk knowledge and practices to provide assistance, support, and facilitations for individuals with health needs, while professional nursing care is a cognitively learned approach to healthcare, aimed at improving health, preventing illnesses, and aiding in dying or other human conditions, typically acquired through educational institutions. According to McFarland, culture encompasses learned values, beliefs, norms, and life ways that guides behavior and decision making. It is equally important as care, viewed as closely linked phenomena with interrelated ideas.
So next is about culture care. Madeleine emphasized that caring is a universal phenomenon, but it's expressed differently across culture. Culture care involves understanding and integrating patients' cultural values into their care.
While culturally congruent care is the major goal of the culture care theory, it involves culturally based knowledge and decisions to suit clients' values and beliefs, aiming to prevent illness, disabilities, or deaths. Culture care diversity refers to the variations in beliefs, meanings, patterns, values, symbols, lifeways, and other features of cultures, while culture care universality refers to the shared cultural phenomena in human beings or groups guiding caregivers to provide assistive and enabling care for healthy outcomes. While worldview is a person's perspective on their world, this influences their orientation towards life and the universe around them. Cultural and social structure dimensions. This encompasses the interrelated patterns of structured features in a culture, including technology, philosophy, kinship, values, economics, education, environmental context, language, and ethnohistory. Environmental context. Environmental context encompasses the entire event, situation, or experience that elucidates people's expressions, interpretations, and social interactions within specific geophysical, ecological, sociopolitical, and technologic factors within specific cultural settings.
So next is about ethno-nursing. This term refers to the study of culturally relevant care practice within specific cultural group. It involves understanding how culture shape the nursing process and patient interactions.
Emic refers to local, indigenous, or inside out of the box knowledge and views about specific phenomena, while ethic refers to the interpreted values and knowledge of outsiders, often health professionals, about cultural phenomena. Let's now talk about health. Health is a culturally defined, valued, and practiced state of well being that enables individuals or groups to perform their daily activities in beneficial life ways, and restorative well being that enables them to perform their daily lives. There are also three culture care that will be further discussed in the meta paradigm. Here is the meta-paradigm of Madeleine Leininger's transcultural nursing theory. They called it the Sunrise Enabler to Discover Culture Care Sunrise Model. Worldview is central to understanding a patient's health, beliefs, and behaviors. It influences how people define health, illness, and appropriate treatment. Understanding a patient's worldview helps nurses to provide a more culturally congruent care that respects and integrates their cultural norms. It focuses on the fact that different cultures have different caring behaviors and different health, illness values, beliefs, and patterns of behaviors. In addition to the meta-paradigm concept, the Sunrise Enabler incorporates these dimensions or other factors influencing the patient care. These dimensions are the number one, technological factors, which is where the role of modern and traditional technologies in healthcare practices affects the patient care. Second is the religious and philosophical factors. This is the patient's spiritual beliefs that influences their health behaviors. The third one is the kinship and social factors. This is where the family structure, roles, and community support will influence the decision making of the patient. Fourth is the cultural values and lifeways. These are the beliefs, norms, and traditions that guides how a person views health, illness, and healing. Fifth is the political and legal factors, and this is how healthcare policies and laws affects access to care. Sixth is the economic factors. This is where the patient's financial resources affects or influence their healthcare decisions. Seventh is the educational factors. This affects the patients how they perceive health, illness, and healthcare interventions. The cultural care worldview flows into knowledge about individuals, families, groups, communities, and institutions in diverse healthcare system. This knowledge provides culturally specific meanings and expressions about care and health. The next focus is on the generic or folk care system, professional care system, integrative, or the nursing care. Information about these systems includes the characteristic and the specific care features of each. These informations allow for the identification of similarities and differences or culture care diversity and culture care universality. Generic or folk care is the traditional learned knowledge and practices when it comes to nursing, while the professional care practice are formal and professional knowledge and practices obtained through education. The integrative care practices is a unified nursing care knowledge and practices, and it acts as the bridge for integrating generic and the professional care nursing. Next are nursing care decisions and action which involve cultural care preservation or maintenance, culture care accommodation or negotiation, and culture care repatterning or restructuring. It is here that nursing care is delivered. Culture care preservations or maintenance refers to those assistive, supportive professional actions and decisions that help people of a particular culture to retain or preserve or maintain meaningful care beliefs and values for their well-being, to recover from illness or to deal with handicaps or dying. Cultural care accommodation or negotiation refers to those accommodating or enabling creative professional care actions and decisions that help people of a designated culture or subculture to adapt or negotiate with others for culturally congruent, safe, and effective and beneficial health outcomes. Culture care repatterning or restructuring refers to the assistive, supportive, or enabling professional actions and decisions that help clients reorder, change, or modify their lifeways for beneficial healthcare patterns, practices, or outcomes.
Transcultural nursing theory is highly significant in the nursing profession because it emphasizes the role of cultural awareness in providing patient care. Leininger recognized that patients come from diverse cultural backgrounds, and these backgrounds can profoundly impact their health beliefs, behaviors, and responses to medical interventions. Here's how her theory is useful in the nursing practice. Number 1. Culturally competent care. Leininger's theory teaches nurses to be culturally competent, meaning they are able to deliver care that respects the cultural beliefs and practices of the patient. By understanding a patient's cultural background, nurses can tailor interventions that are more likely to be effective, leading to better patient outcomes and satisfaction. Number 2. Holistic patient care. The theory supports holistic approach by recognizing that cultural, spiritual, social, and environmental factors can influence a patient's health. Nurses are encouraged to consider all these elements when developing care plans, ensuring they address not just physical health, but also psychological, emotional, and social well-being. Number 3. Improved communication. Cultural sensitivity helps nurses communicate better with patients from diverse backgrounds. Understanding cultural differences in language, gestures, and communication styles reduces misunderstandings and enhances the patient-nurse relationship. Number 4. Patient-centered care. Leininger's theory promotes a patient-centered approach, where the patient's values, needs, and cultural practices are central to the care plan. Number 5. Reduction of health disparities. One of the primary benefits of Leininger's theory in nursing is its potential to reduce health disparities. By acknowledging and addressing the cultural factors that may affect access to care or treatment outcomes, nurses can help bridge the gap in health services for minority or marginalized populations. Understanding cultural barriers such as beliefs about illness, stigma, or differing perspectives on healthcare enables nurses to advocate for equitable care and ensure that all patients, regardless of background, receive quality treatment. Number 6. Cultural assessment as a nursing skill. Leininger's theory equips nurses with the tools and frameworks needed to conduct cultural assessments. This involves understanding a patient's worldview, religious practices, dietary restrictions, family dynamics, and traditional healing practices. Such assessments ensure that care is aligned with the patient's values and lifestyle, promoting faster recovery and greater satisfaction. 7. Global nursing practice. Leininger's theory is especially relevant in today's globalized world, where nurses may encounter patients from many different cultural backgrounds. Transcultural nursing is crucial for healthcare providers working in diverse communities, international settings, or humanitarian missions, ensuring culturally appropriate care in any context. For example, when caring for a Muslim patient, a nurse might arrange for halal meals, accommodate prayer times, and negotiate fasting during Ramadan if it conflicts with medical needs. Through this, the patient feels comfortable, respected, and supported throughout their hospital stay. The nurse's awareness of sensitivity to the patient's cultural and religious needs leads to a positive care experience and a quicker recovery because the patient adheres to the treatment plan.
We are the reporters for Madeleine Leininger's Nursing Theory. Thank you for listening.